Welcome to the Caregiver Relief Podcast, where we explore real-world solutions, expert insights, and compassionate support for those caring with aging loved ones. I'm your host, Diane Carbo, RN. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today's guest is a true powerhouse in the field of holistic aging and senior care. I'm thrilled to welcome Linda McDougall, a holistic healthcare practitioner, author, educator, and massage therapist who brings decades of hands-on experience with seniors, individuals with disabilities, and those navigating mental health challenges. Linda is the author of the award-winning book, The Spirit Method of Massage for Seniors, Raising the Bar, a primer for massage therapists and caregivers, which is now required reading for therapists with Massage, Inc. Her work bridges physical care, emotional insight, and compassionate advocacy, all shaped by a remarkable journey that has taken her from direct care worker to federal advocate for Hawaii's developmentally disabled. That's a big word. As a baby boomer herself, Linda offers a unique perspective grounded in both personal experience and professional wisdom. She's here today to share how massage therapy, mobility, education, and a whole person approach can transfer the way we support older adults and the caregivers who care for them. So whether you're a caregiver, a health professional, or simply passionate about aging well, this conversation will open your eyes to an often overlooked details that can make all the difference. So let's dive in. Linda, thank you so much. It's such a pleasure to have you here. For those who may be new to your work, can you share a bit about your background and how you became so passionate about caregiving, holistic health, and elder care?
Like you said, I have been decades with the developmentally disabled in all sorts of roles, from caregiver all the way up to the federal advocacy for Hawaii. That took me through most of my youth. And then as I began to age, I went into massage for seniors and holistic health and advocacy and all the rest that you mentioned, because everybody loves kids. They give kids just about anything they can, but seniors get left out in the dust.
They really do. I agree with that. Yes.
And it's really sad. And my passion is about what's behind me, the mobility devices and what's going on with seniors in that arena. And it started to dawn on me when I was in Hawaii, because I fell down some stairs, broke a bone in my foot, and ended up with being given crutches. I didn't know any better at that time. So I went out like this because they gave me these big old crutches, and they hadn't adjusted them for me. They hadn't even considered that I was a much smaller person than those crutches were meant for. And I fell, and I fell, and I fell. And at the time, we were living in a 3-story apartment, little skinny thing.
Oh, no. Oh, no.
I couldn't go up and down with the crutches. So I crawled up and down stairs.
Oh, God bless you. I did orthopedics as a young nurse. And to this day, when I see people walking with crutches, I always feel compelled to help them make sure it's fit right because it's neglected nowadays. People don't know what they don't know. And
Exactly.
the healthcare system has failed us in that way. It's just hurry up, get them in, get the product, and get them out. And
Yes.
so crutches alone need to be fitted properly for you.
Yes.
Yeah.
They can injure the lymph nodes and everything else underneath the arm.
Mhm.
And they could injure me because I kept falling.
I'll tell you what, I was told I needed crutches a few years ago, and I have a bad shoulder from falling off a horse. And there is no way in God's green earth I could use crutches. It's just not possible. And I had to argue to get an alternative suggestion. Can't make this stuff up. Oh, well, you've written an award-winning book, The Spirit Method of Massage for Seniors, and it's getting a lot of well-deserved attention. What inspired you to write it, and what do you hope massage therapists and caregivers will take away from it?
When I began it, it was strictly for massage therapists. But as I was writing it and rewriting it, doing all that, it dawned on me that a lot of what I was putting in there had to do with holistic health, and that the caregivers could really need that kind of information, as well as these devices.
Yes.
And all of these devices practically are not being done properly these days. I'll give you a quick rundown. I have a legislative proposal that I've written that's in with my local area agency on aging. But the whole problem starts with the doctors not looking at their clients and sending them to OTs, PTs, or ATPs for assessments.
Amen. I agree.
Starts there. And because they don't document and send on,
Yes.
if they ever go to a home,
Yep.
then licensing comes in and takes things away. There's a case up in Washington that I heard of. Didn't turn into a case because the woman could advocate for herself, luckily. But they tried to take away her prosthetic leg.
Oh, my Lord. Oh.
Now, this is all under the guise of safety equipment versus restrictive equipment.
Oh.
And everything's a restraint according to licensing, so you can't have much of anything if they can take it away from you. So if you look,
and that thinking with a prosthetic leg, because it isn't a restraint, it's actually giving her the ability to have independence.
exactly. And luckily, she was bright enough to eventually, after arguing with them for quite some time, she threatened them with calling the police and saying they were harassing her. That's the kind of thing that's going on.
Yeah. And you know what? I'm glad you're bringing this up because it's happening more than people realize. And one of the points I want to make here is you have to reach out and ask for your doctor and demand nicely, but demand. You want an evaluation by an OT, PT, or speech therapist, whatever it is that you're needing support for. If they're going to give you ideas or support of some way for a prosthetic or assistive device, it's a challenge. They just give them to them and and the wrong sizes and the wrong fit. And with wheelchairs, you need different things like cushions, and
Yes.
don't realize that. So let's talk about mobility devices, something we often see in homes and care settings, but rarely question. What are some of the most common ways mobility aids like walkers, canes, or wheelchairs are misused?
Oh, God. Well, first of all, if you're in a home, they've taken away your seatbelt.
Yep.
You will not see a seatbelt. I don't think you will see a seatbelt.
No.
If you do, wonderful.
Yeah.
And because they think they're a restraint. And yes, yet they can be used as a restraint. And the reason all that came into play was because we over-restrained at one point in time. And so now it's swung the other direction to a fault. I have seen, while working on one client, I have seen another client slide right out onto the floor.
Oh, I've seen it many times. Yes.
That's unnecessary. And it can break bones. It can cause all sorts of, talk about restrictive. What if she broke her hip?
Exactly. Or suffered a head injury from the fall.
Yeah.
Yeah, we've gone the other way to the point of ridiculous.
Yes.
I have to say, and I know people won't appreciate hearing this, but government involvement has got to stop in some of this stuff. We've got to, because the people that are making these decisions are business people. They're not professionals all the time. And it's really causing harm to our healthcare system.
And especially to seniors who don't need any more harm.
Exactly, exactly. You're absolutely right about that. And I see it all the time, and it's making me crazy. And it's getting worse. I don't know if you're aware of this, but Medicare has cut reimbursement for rehab down so low that facilities get a higher level of reimbursement if they don't provide rehab.
Oh.
So what we're seeing is, and this is frightening because they say we have 100 days of therapy covered by rehab under Medicare guidelines, but the reimbursement is so low that people are getting discharged in the first 20 days. And I'm witnessing the most unsafe discharges to home that I've ever seen. It used to be just with the Medicaid clients. That's been going on for decades. I will tell you right now, decades it's been going on. But now it's the seniors and Medicare, and it's really frightening to me what's going on. I can't tell you the things that are missed all the time. And I don't know what we're going to do because family members don't have the knowledge or the experience, and they don't even know what to ask. And when a family member is coming home, they're not even giving them home care properly. I had a recent discharge where a patient was sent home with a wheelchair, and they didn't do a home evaluation. They're cutting corners. She had 17 steps to go into her bedroom and upstairs to get into her accessible bathroom. She had no bed downstairs, no access to the toilet downstairs. They didn't order her a commode. They ordered a PT to come and see her when she definitely needed a nurse because she had new seizures diagnosed, a urinary tract infection that they sent her home with. It wasn't fully resolved. And and she falls within the first 30 minutes of being home. And of course, I wasn't there because if I was, I would have sent her right back to the hospital. But her husband, he says, how am I going to get her into the bathroom? And luckily, this is sad, a student nurse, my roommate's daughter, helped her. And she says, you need to go out and buy a commode chair. And he did. And of course, he found the cheapest one he could, which it was challenging, and we couldn't even get her to the bath. We couldn't walk her to the bathroom, and there was no bed. They had this beanbag type of kidney-shaped wicker chair, and she was in that chair, and it swiveled and everything. We couldn't get her into bed, and she spent days in that because the facility wouldn't order a bed, said she was independent upon discharge. And this was just a few months ago.
And this
is really happening. You talk about the phrase, the vices of mobility devices. Can you explain what you mean by that and how these well-intentioned tools can actually cause harm if used improperly?
We talked about the lady who scooted out onto the floor on her hips because of no seatbelt, but any of the ones where you're walking with them, whether they're canes, crutches, or walkers, all have to be adjusted properly for you. I live in a big 55 plus senior community, okay? Mm-hmm. And I see butts in the wind because they're leaning over the walker.
Yes.
Instead of standing up. They're meant to support your frame standing up fully, not bending over. As I say, you don't need to grip them. It's a matter of life or death if you stand up properly.
Exactly. Yeah.
If you stand up, I used to watch my mother-in-law before I knew too much about this. And she was a little tiny thing. And she would go down the ramp that was supposed to help her, changing for the walker. And I was just waiting for her to do a nosedive.
Oh, yes.
So you have to have it so it fits you so that you can walk upright properly, not with your butt in the wind.
Yes.
You're supposed to walk with the walker, part in, part out, but not with the butt in the wind.
Yeah.
And not with your shoulders up in your ears. I've seen that.
Yes.
I've seen so many people that could have used upright walkers, but in my entire 2 decades or more, I have seen 2 upright walkers in that whole time. And one of them was homemade by the husband.
Oh, Lord. Yes. You know what? That's the other thing. I think reimbursement or payment. Now everybody has to buy their own. It's not covered. Very little is covered by Medicare right now as far
I don't know how to buy. No.
and they don't know how to buy. They're not, and they go in and they want to, when they purchase something, they just purchase the cheapest because they're trying to just get through. They don't think of the future and they don't think about all the things. And how do you address that? And like, it's my goal to educate people on this stuff, on how to get properly fitted and use it properly, because there is physical damage that can result from this.
Yeah. Being a massage therapist, that's what I deal with. I walked into one young lady got me to her father who was in one of the local homes. And he was having all sorts of neck and back issues. As soon as I walked in and saw what he had, I went, oh, yeah, of course.
Yeah.
Because he had, again, a walker that was way too high. So all his shoulders, everything, and he was forward as well. So he was just a wrecking. He told me I had angel hands because I worked on some of that stuff.
Bless them. Oh,
And, I just took one look at him and I said, you need to I showed him how to do it.
uh-huh.
And I said, now you need to get some of the maintenance people from your home here to lower it to a proper, and I showed him how to do that.
Uh-huh.
I worked on him twice. That was it. And he was fine.
I'm 72. I did a lot of rehab nursing in my early years. So my whole body, because in those days, we lifted a patient. We didn't have a lot of mechanical assistance. I was in the Flintstone days. But I did rehab and we didn't use the Hoyer lift very often. And we did fireman lifts and so my whole back and my thoracic and my back hurt. And then from other injuries, when I think, how am I going to use some of this equipment when I'm older? Because I'm sure I'll need it. But so what are some of the long-term consequences caregivers and users should be aware of?
Oh my goodness. Okay. If you're incorrectly in a walker, say,
Uh-huh.
and let's say it's too high. First of all, you're going to get all this neck stuff. You're going to get the arms. You're going to get even the wrists.
Yes.
So you're going to get that whole area and the upper back all messed up because you're doing like this. And that's not where your body ought to be. Your body ought to be like this.
Yes.
Okay. And the other thing is when people go down too far, and then you're looking at a neck that becomes a U.
Yep.
Because the eyes try to level.
Yeah, try it. Yes, yes, yes.
And so you get this. I had one poor lady in my brain, I called her turtleneck because she would always go around like this. And she was such a sweet lady, but I knew she was killing herself with that.
I have seen that as well in the nursing homes many times.
Lots of it, yes.
Yeah, it's really unfortunate. Again, it comes down to people not knowing what they don't know, the families and the facilities not providing the support with professional staff that can actually do something because it takes away out of the funds and it's all financially based. If you can't get money for an evaluation, they're not going to do it. And that's what we're at right now.
And a lot of it is also the licensing coming in and taking away what you do have. And so let me go back to that, because you have to talk to your doctor. You have to get them to document what is wrong and why they're sending you to a PT, ATP, or OT. Okay. And then that person that you get sent to needs to fit you and train you on whatever device it is. And they need to document so that it's all in your medical records. Because if you then go to a retirement home, whatever you want to call it, then it's in your medical records, and they can't take it away because the doctor has said so. Okay. And the PT or OT or whomever has said so and documented. If you don't have documents, you don't get anything. They'll take them away.
Oh my, that's
all documentation.
Oh my, you know what? I've seen that, but I didn't know that it was a major issue. And now I do. Oh my, it's probably worse now than ever before.
Yeah. And it's probably going to get worse.
It's going to get worse.
Yeah. So you really need, as a family, to know to do that.
Yes. How can caregivers recognize when a mobility device isn't properly fitted or being used correctly? And are there visible signs or behavioral clues that we can look for?
Well, like I said, let me see if I can stand up and do anything. I don't know if I can do it this way, but we'll see.
So we'll explain to you.
Okay, you need to.
This is audio anyway. Explain what you're doing as you're doing it.
Chain needs to be right here. And so there's a walker. You just need to be able to hold onto it. So the elbows are very lightly bent, but not very bent.
So you have your hands at your side.
Yes.
And you're saying that the walker should be located where your elbow is slightly bent?
Yeah, just slightly bent.
Okay.
You'll see people with higher ones with their tail, like I said.
Yes.
And then they're not walking properly. You walk inside the walker just a little bit and outside just a little bit as you step.
Okay.
So you're not walking totally outside, which a lot of tailwinders do.
I love that terminology. Oh, that's
what is so sad. Think of the pain in that lower back.
Yeah. I just think about my neck and my back. So I'm like, oh my God, that looks painful to me.
Yes, and it is.
Yes. Posture and ergonomics play such a critical role in comfort and safety. Can you speak to how posture is affected by mobility devices and why that matters? Because people don't understand that if it looks uncomfortable, it probably is.
Exactly. And you get people like me in there that are then called in to work on these people, and it's like Groundhog Day because they have the wrong equipment.
Yeah.
So you're having to go back in and help them live with what they have when what they have isn't right and it's continuing the problem. People don't realize that when you bend forward like this, and you see a lot of old people like this.
Yes. Yes.
These muscles are tightened.
In your shoulders and
back muscles are stretched. So the back is weak. This is strong.
Yes. So when you're bending forward, you're actually stretching your back muscles.
Yes.
And your neck muscles are, I can't even hold my heavy head up. They're tightened.
Because usually they're like this.
Okay. Yes. They're bent forward with and I see so many, even commercials where the little old lady is walking and she's got all bent down and she's got her arms up to her beyond where her shoulder level should be, trying to walk. And it's just pathetic. And I think, oh my gosh, they need to make her stand straight. I always tell everybody they have to be like a little soldier, stand straight. Let's work around your body. Oh, so what should caregivers know before purchasing the device, and who should they consult to make sure it's the right fit and set up for their loved one?
Again, it's an OT, PT, or ATP, and you're going to find that these people aren't all the same. They don't all know the same thing. So you're going to have to look around for the one that knows and actually works with the equipment. An ATP is more likely to, it's an assistive technology professional.
Uh-huh.
But like in this county, we only have one, and I couldn't tell you who that is right now. I met one of the people that worked with him one time, so I know he exists, but I don't know who he is or where he is.
I just had a conversation with, and there's a whole new field of certified durable medical equipment specialist and assistive device specialists. And there's not many of them, and
Yeah.
we desperately need them.
Yeah, we desperately do. And the PTs are usually the more common people that do this type of thing, but not all of them know. I went into one of my local homes, and it was a lady that I didn't know, but I every once in a while will have a big mouth and say something I maybe shouldn't. But I watched her, and she was almost okay, but not quite. She was still, the elbows were still too bent, and that thing was, the walker was a bit too high. So I asked her about that. I said, do you realize that this is not, hey, not doing well and for you? And she goes, no. I said, what? You need it a little bit lower, not much. You're pretty good.
Yep.
You need it just a little bit lower. And I said, do you have an OT or a PT? She goes, oh, I get both of them coming to my room.
Oh.
And I went, oh God, and neither one of them have said anything. And no, they hadn't. And I'm just going, so that's what I mean by not everybody knows the same things.
No.
So,
well, and the other thing we have to address is that many of the physical therapists may not be doing the actual hands-on. They may be just, it's the physical therapy aide who may not have the experience, or the physical therapist. I'll tell you right now, physical therapists are coming out of school, and because I just have a dear friend whose husband graduated, and he's not allowed, he's given 15 minutes and he has to get in and get out, and he's leaving the profession because he's not able to provide the care and in a way that meets his standards, or what the quality of care that he was supposed to be providing.
And that's a whole nother thing that's happening. I'm on LinkedIn, and I'm connected with a lot of doctors who are upset about this. I'm connected with physical therapists that are upset about this, nurses, you name it. They're all looking for ways to get back to private practice. And I hope they do, because this is insane, giving 15 minutes to somebody to do something like that.
I will tell you right now, the Medicare is moving to a cost-sharing platform, and the MA, the Medicare Advantage programs are already there, and it's frightening. Perfect example, I was touring a family, showing them this rehab facility, and the couple before us, I heard them crying, literally sobbing, and I thought, oh, somebody's died, and we'll be patient. Turns out, no, that wasn't the fact at all. The fact was their 84-year-old grandma or mom had a stroke, and she had a Medicare Advantage plan, and in the copay for that plan to be in therapy in a rehab center was $250 a day. Who in the hell has that kind of money? People aren't able to afford it. Linda, it's very frightening to me. I'm hearing all this. I just had somebody say that they have MS. He was in the hospital. He was in a rehab hospital. They sent him home after 10 days because the hospital used his rehab benefits. And I don't know how they did this. I don't know, because he was in acute care for a spinal cord injury. Anyway, they sent him home, and he was in rehab, and they didn't even tell her when he came home. He had a wound on his heels from being in bed too long while he was in rehab. And he's a diabetic. And I'm like, how does that happen? But rehab, it used to be, we get them up, you get them moving, you get them dressed in their clothes. They go to therapy in the morning. They come home back to their rooms for lunch. They all take a nap for an hour or so. Then they're back at it again for rehab. That, and even in skilled facilities, it was they had something every morning and afternoon. And now I can't believe it, but they're leaving them in bed for days. That just shocks me. It just, how do you improve? How do you get better if you can't? And I guess I hear this and I just think, oh my God, what's happened? I never in my life as a rehab nurse would I think anybody would remain in bed. Sundays were their favorite days. And I get it. It was mine too, because patients in rehab got to sleep in for a little bit. We didn't force them to go. It was their day of rest, and that was their business company when they had company and could enjoy their days a little bit. So I'm really disappointed, afraid, and disgusted with our government-run healthcare because it's just gone down the toilet, and we have the illusion of healthcare, but it's the responsibility of us as private citizens to pay for that care that's being recommended. And it's sad.
Yep. It's real sad.
Yeah. And I know you know about this because you're into legislation and advocacy. And Linda, I want to make sure we touch on those legislative efforts because you've been advocating for changes in how elder care and body work are regulated. Can you share more about the work you're doing and why it's so urgently needed?
I talked about the doctors being owned by the insurance companies and everything trickles down from that. My legislation, it actually addresses the bottom layer, which is the licensing, coming in and being able to take things away. And basically it goes through what the problem is and then talks about why can't we have a supportive licensing that helps educate. That's what I had when I ran my group homes.
Okay.
I had the first lady that went through came by with a bloody axe, is what I usually say, because she was just there to kill.
Yeah.
And I was brand new, hired, and I had never had to deal with licensing before. And it was a freak show. I was really just scared.
Yeah.
And she ended up having a nervous breakdown about a month later. So apparently this was more her than licensing at the time.
Yeah.
But after that, I got what turned out to be a dear friend of mine over time. She just died last year. And she and her team were there to support and to help me grow because they knew I was new. They knew they were going to find stuff, and they did, of course. And so they helped me until I was one of the best homes in the county.
Oh, that's impressive. That's good.
I was there for 11 years, and they were there for much of that time.
Wow.
And it was just, it's so different than it is today when they're coming through and just ripping everybody and taking away. I had a friend of mine in a local home here that was all upset because she said licensing came in and I had this client in a recliner and they made me get her up. Now she needed to be in a recliner because she's in a wheelchair all day and she needs to get off of her tail end.
Yes, yes, yes.
But then they got all upset and had her go back in the wheelchair because she couldn't get herself out of that chair. Okay, she can't, but there were people around like my friend. It wasn't like she was just being left there.
It's very frustrating because I've seen, here's the other end of the spectrum where I have patients that have in nursing homes, residents in nursing homes that have developed bed sores, pressure sores, huge ones, and they shouldn't be getting up in a chair. Because they can't. They need to be put in a recliner on their side and turned or whatever, and they don't do it. But you know what makes me crazy is these facilities, because licensing comes and they want them out of their beds and in their chairs. They're putting people that should never be in a chair because of their wound in a chair for hours. And it just defeats the healing process and everything that they're accomplishing. They're undoing all their work because they're trying to make these people that are, I call them government bureaucrats, but and they are, but and so many of them have no knowledge of healthcare. They don't have any nursing background, or they're not doctor background or therapy background. One lady that was making decisions was in real estate before she got to it. And I'm thinking, oh my. And that's the kind of people that are coming in from the licensing agencies, boards, to approve a facility. And it can't be black and white, but it is. It's black and white.
Pretty much.
Yeah.
There may be a few people here and there that do it better than that, but
Yes.
I see so much black and white and have seen it for a long time that it's just sad.
There's this big movement now where nurses, I'm sure you're seeing this too, because you're out there. Nurses and staff are not allowed to pick up somebody off the floor. Now,
I haven't seen that.
Oh my God, there's some states here that the absurdity of it, they have to literally call EMT to come and pick a patient up off the floor. I think Wisconsin or Illinois, one of those states is huge. You can't, and it's a big movement. They don't want nurses and staff to hurt themselves. Hello, what's the dignity in letting a person stay on the floor? And here's another issue. They use these bed alarms and stuff for people that are getting up and falling out of bed. And as the old rehab nurse in me, we used to have low beds for people, or even put the mattress on a floor with a bound, like a little gate around it to keep a patient safe, so they wouldn't fall because they were rolling and agitated and stuff. And I made a comment to a facility. I said, as a care manager, I said, this guy needs a low bed. And they said, we can't have a low bed. Well, why can't you have a low bed? His chances of hurting himself and harming himself are significantly decreased, because if he rolls out of the bed, it's just a short 6 or 12 inches, and he's got the mat there that's going to make it comfortable. And it literally was a challenge. They refused to do it. So what's he do? He gets out of bed and he falls and he ends up with a head injury in the hospital. There's no common sense. And it's very frustrating to me as an old, seasoned health worker.
I'll tell you a story that's similar to that, but opposite of that.
Okay.
One of the local facilities many years ago, this was quite a while ago now, I was doing my Vices of Mobility Devices talk and show and tell thing. And at the end, I was getting a lot of questions. So I was standing around talking to different people. And this small, diminutive lady comes up and says, when you're done, will you go up to my room? I want you to see something. I said, yeah, sure. So I went, and here is this tiny woman. She's got a pedestal bed.
Oh.
That woman could barely get her little butt get purchased on the bed.
Yep.
Her butt was in the air. Her head was almost on the floor. And here she was trying to get purchase on the bed. Yeah. And then when she got a tiny bit of purchase, she threw her legs over onto the bed.
Oh, my Lord. Oh.
And then she clawed her way into the middle of the bed. And I was going, who didn't see this? This shouldn't have never been allowed in. Or they should have taken the pedestal away. Something. She could have easily done exactly what your person did and hit their head.
Yes.
And broken a neck, God knows what,
I have had 2 situations with people in their homes. I'm a little old lady, so I can call them little old ladies. And they're having fall issues and balance issues, and they have the pedestal beds. And I walk in, and that's the first thing I say is, you got to get the bed out and get a reasonable bed in here. This is impossible. And I cannot tell you how the families and the female that wanted that bed wants that bed. And it doesn't make it,
No,
Both of them ended in bad ways
of course.
because they let vanity or their whatever reason to have this big, beautiful bed. I get it. But I told them, just let me saw off the legs.
Exactly. I have 2 mattresses and they're on the floor.
Yeah.
I don't have a bed as such with all the paraphernalia. It's simply 2 mattresses on the floor.
Yeah,
That way I have to force myself to get up, which keeps my legs going. Instead
yes.
of walking the dogs and doing all that.
Yeah, exactly.
Yeah.
Exactly. People don't realize falls are the #1 independence robber of seniors. And a fall can
Yep.
keep them from ever returning home again, ever. And people don't realize this because the modern home is made for a young body, not an aging body. And unless you've made changes as you've aged to accommodate the aging body, you're not going to be able to return home. With the serious, I was literally walking a dog a few years ago, and this dog is a challenge to walk. She does whirligigs as I'm walking her. She was a sweetie, but I'm walking her, and we're in a neighborhood where the houses are a little far apart, and she's on the end of a cul-de-sac, and there's no, but all the other neighbors have their vacation homes. They're not there all the time. So I'm walking the dog and I see this lady on the floor, driveway. And I said to her, "What are you doing down there?" She goes, "I fell." I said, "You did?" I said, "How long have you been sitting there?" And she goes, "Oh, about an hour." I went, "Oh, God almighty." She didn't have a life alert on. She had just had, this is what scares me. She had 1 total knee done. She's had
Oh,
hips done. And she says, "I can't get up because I have bad knees and I need my other surgery." And I went, "Oh my Lord." And I said to her, "Where's your walker? Do you have anything?" She didn't have anything to help and support her. And I was really concerned. So, of course, I got her up and I got her in the house. I had to take care of the dog, which was a challenge because she was a puppy. She just wanted to jump all over. And I'm trying, please don't knock this lady over again. But yeah, and she had just lost her husband a few months before. And she tells me, "I went out there to rake leaves." Oh, Lord. And she slipped on a wet leaves and fell. And seniors just, I know they don't realize how 1 fall can change their entire life. And there's nothing wrong with having a life alert system or using a walker, or if she's going to rake leaves and she's got a bad knee, how about you pay someone to do it? Or if you really feel compelled, take your phone with you. So if you do fall, you can call somebody for help.
or get a leaf blower. I got a leaf blower.
There you go. There you go. It's really sad. I'm fiercely independent. I get it. I hate for anybody to have to do anything for me. And I know there's a lot of seniors that are like that. But I know personally, you have to have, it's a personal growth experience to accept help and accept that maybe I can't do everything I want to. My mind is willing, my spirit's willing, but this old body of me and mine is failing me, and mine is. With all my pain and stuff from all the years of, I tell people I used to pick up men for a living because I literally did. And it's just being silly, but and I love when people react and what is she talking about? But in those days we did pick people up and it was hard. Big guys. I'm only 5'2", but I'm strong. I've always been strong because I had to be lifting patients. But when you're doing fireman lifts and helping people off the floor, it's a challenge. And that's the other thing. I want to talk about empowering caregivers. They don't know what they don't know. So, what are some simple adjustments or actions that they can take to improve safety and mobility for their loved ones who use assistive devices?
If you can keep a seatbelt, that's a really good thing for them to stay seated in their device. It's also really good to have postural supports. and wheelchair. Okay. But what I find is that most of the wheelchairs are the wrong wheelchairs to support the support devices.
Yep. Yep.
When I ran my 2 group homes for United Cerebral Palsy, these were adults that could get anything they wanted from head to toe because they were disabled.
Yes.
Seniors get it taken away.
Yes. Yes. Yes.
It's just the opposite. It is totally insane. But yeah, you've got to get to the professionals, get somebody like the PTs to really look at your senior and to get what is appropriate for that person support and get it documented so you don't have problems later on with licensing.
That's a good suggestion. I didn't realize that was such a serious concern. And I've been a nurse for 50 years and I worked in long-term care. So that really is a surprise to me. I knew it was happening, but I didn't see it that much. And I'm sure with the seniors now, we're seeing it even more.
Oh, I see it everywhere.
Yeah.
During the pandemic, I did podcasts from coast to coast. And I surprised everybody, and everybody went, "Oh, yeah." And I'm going, "Yeah." I'm the only one that seems to be talking about this. So it just became my passion because nobody else was in the space. And I'm going, how can they miss this?
Yes.
Huge.
Is missed in healthcare, that's for sure. And it's really frustrating for me because I see it. And I will tell you that doctors don't know what they're ordering when they order. People think, oh, the doctors say get a walker. And you're right, he doesn't follow through and say, get a PT eval to get it fitted right or whatever, or the right type, because there's so many different kinds of walkers. There's later. Yes, yes. There's one with handbrakes. Somebody with dementia is not going to know how to use a handbrake. Or some have seats that you can sit on when you're tired, which I really like those, but there's so many different kinds. And if you've got shoulder issues like I do, or wrist issues, there has to be adjustments made to that equipment to decrease your chances of pain and suffering.
And again, that sounds like a stand-up walker. So
Yeah.
they're not putting any weight on the wrist.
Yep, yep. And what I'm learning is our new PTs aren't getting the experience they should to learn these things. And it's unfortunate.
It's a crazy world out there. It really, really is. And I don't know if I'll be gone before it fixes itself or if
You will be gone before it fixes itself. Well, one of the big things we're seeing is hospitals, community hospitals are closing, not because of Medicaid, but because of Medicare reimbursement being so low and the government loopholes you have to jump through to get anything paid. And nursing homes, this is frightening me because at a time when we have a silver tsunami coming our way, we have nursing homes closing because the skilled facilities are the part of the nursing home that generated income for the facility to keep those on Medicaid in providing care. But now that they've cut the Medicare reimbursement so low for therapies and people aren't getting that, it's not sustainable. And we're seeing an unprecedented number of nursing homes close, especially if they had a skilled unit, and most of them did because that was the money-making part of it, they're not going to exist anymore.
We have such a mess that needs to be cleaned up and restructured, and our doctors need to be in private practice again with insurance backing up. They're not doctors.
No, the government policymakers have taken over the role of the doctor in the doctor-patient relationship. And the other thing I'm seeing is the government regulators are making these decisions and they don't realize the negative impact that it's having on our health care.
Maybe they don't care. I don't know what to do.
And here's the other thing I want you to know. I don't know if you're aware of this, but the Accountable Care Organization, they're moving to an ACO. That's what Medicare is. And it's literally to push the private solo practitioner out of business. And it's happening now. They're making it so that And you know what this is? This is universal health care. And if you look at England or Canada and see the delays in care or the inability to have a bed, they have in Canada or in England right now, they have 30,000 people waiting for life-saving surgeries and care. And they wait, like they're literally told week to week if they can have a surgery or not. So that 50 years ago, I got my nursing license and I've worked all over the country. And I can tell you, I have taken care of Canadians and people from other countries because they could come here, get treated, and go back home before they were even going to have a diagnostic test done. And now we are becoming that way. And universal health care is doing so badly because the government policymakers have taken over the role of the doctor. So doctors aren't allowed to practice the way they are trained, and they're not getting paid well. They just keep cutting them down. Doctors today make less, are reimbursed less than they were 20
Oh, yeah.
years ago. Yeah,
Yep.
20 years ago or 40 years ago even, from when they were starting out. And it's because they require more staff to handle all the government loopholes you have to and regulations you have to go. You have to get things prior approval. You get denied. You have to go to appeal. The doctor can't tell you what he can do because of that. So they really are. It's a big thing. For the first time ever, the American Medical Association is finally, I'm going to say they got their balls. And that's bad, I know, but I don't care. They are finally taking the courage to stand up to the government and say, enough is enough. We can't do this anymore. It's
Good.
a shortage of doctors, a shortage of specialists. We have nurses leaving the field because they're expected to provide care that is not humanly possible. The aides in the nursing homes are pushed to their limit,
Yes, they are.
and they're not paid well. They are expected to provide care that nursing homes are not. They are not scheduling staff according to acuity levels. They're doing it based on minimum state requirements, and it's just not enough help. And it's really sad.
Yeah, the whole system really needs a big overhaul and go back to the way it used to be.
I know. And you know what worries me is we keep hearing, and we need to have free care, free care. Free care isn't free. And when you provide free care, you are not getting quality care because the reimbursement, everybody good leaves to look into other things. And that's what we're having right now. The universal health care countries have very few doctors and nurses. They're really stretched because it's not financially feasible.
And they're recruiting from us.
Yes, yes, yes. And we have a shortage because it just happened. Obamacare brought us down. When all the reimbursement came to the lower rates of reimbursement to Medicare standards, because I worked for one of the very first private review organizations in the country. And I was shocked. Big companies, I would be calling hospitals, say, what are you doing? Why is this patient in the hospital 2 days prior to surgery? In New York, it was a big thing 40, 50 years ago, 40 years ago for sure. They would actually put a patient in 2 days before surgery to do all the testing that is now outpatient testing because they needed to assure that there was a bed for them. And now that's changed so much. We go in the day of, and we used to have procedures. I'd love to know what the infection rates of some of these hospitals are now, because when I did orthopedics, we used to shave the patient's hairy parts. If you had a shoulder or something or back or whatever, you had to have it cleaned. And then we did 10-minute betadine scrubs before, and then we rinse it off and wrap the area in sterile towels. This is so crazy. And we did it twice, once in the evening before surgery and the morning of surgery before they went down. And when I had my shoulder surgery, the doctor just goes and puts a little iodine on my shoulder, wraps it, wipes it around a little bit, and then sends me on my way. And I'm like, what happened? Unbelievable. But yeah, we've got a mess that we're facing, and I'm fearful for our seniors. So I want to end up with talking about your consulting work, Linda. What's one misconception or surprise that caregivers often discover when they really start looking at how mobility aids are being used?
Oh, hopefully they're looking at just the pain that their loved one or charges in because of the improper usage. Because that's all of this doesn't have to happen.
Yes. Yes.
This is all preventable. And that's what kills me is people do not know what they don't know, like you said earlier.
Yep.
And so they think what they see is normal, and it is not normal. I had a person put together a couple of little tiny 1-minute videos to explain my services. Mm-hmm. And when she brought back the mobility device thing, I looked at her and I said, there's not one of these that's right. And she goes, tell me what that looks like. And I did. She comes back. She goes, I can't find any.
Yeah.
So the pictures you see, the people you see, how many of those are really the way they're supposed to be? And if you don't know and can't answer that, get your loved one to somebody who can answer that.
It's funny because people think because we're old that we hurt and complain about everything. We're discounted and dismissed. I was told one time when in my 60s that women at my age, at 60 and beyond, are invisible. And it's really sad because that made me want to be a glitter goddess. Light and shining, make sure you see me. But it's just really sad because it's very true. So much of the residents in the nursing homes, they're not listened to. Nobody has the time to listen to them when they say, I hurt or whatever. And then, like you said, the lymph nodes become damaged or something. And then all of a sudden it's like, oops, we did something wrong.
And maybe they don't even know it was them.
Yeah, you're right.
It's the old person falling apart.
Yes.
Well, we fall apart for a reason, guys.
Yes. Linda, I am so excited that we had this conversation, and I really want to thank you profusely for sharing some knowledge. I learned things today that really are going to help me in the future and help my caregivers as well. I really think I did. I appreciate that. To my family caregivers out there, I want to tell you, you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care every day. Learn to be gentle with yourself because you are worth it.